7:45, the end of the 12-hour shift. This is Dr. Ernest Patti. Today was definitely busier. We had to intubate a few patients with suspected COVID disease. It seemed like the volume was kicking up again a bit, although not as bad as it was a few weeks ago. You can hear the noise is still somewhat lower than it was when I last reported a few weeks ago. So I'm hopeful for keeping things under control, although we still have to maintain our vigilance and not let our guard down, because these sick people are still coming in, just not to the same degree. Stay safe, stay healthy, stay strong, stay home.
Dr. Ernest Patti from the St. Barnabas Medical Center in the Bronx. You recognize him. We have been checking in with Dr. Patti every week for a few weeks now. He is the emergency medicine chief at the very hard-hit emergency room at St. Barnabas in the Bronx in New York. That little dispatch from him was from just this past week, and you can hear from him this sort of mix of hope and worry, hope that the numbers won't tick back up to be as bad as they were, but also some worry from him. As what he describes as the noises, he means the noises from all the ventilators, start to ping again constantly in the background in his emergency room as they do continue to get new patients who are in acute distress. But in addition to sending us that dispatch from the St. Barnabas emergency room this week, you will also want to see what else Dr. Patti sent us this week, because basically from St. Barnabas this week, he sent us a big multi-part bundle of hope. First of all, he, too, sent us one of these videos. This video shows the release of the 500th coronavirus patient from St. Barnabas. The 500th patient who had beaten the virus and been released from that hospital. Patient number 500 gets to go home, to get out of the hospital alive. And you can see the health workers are so proud, right? Even the firefighters came out for the 500th patient to celebrate his milestone. So Dr. Patti sent us that. Dr. Patti also sent us these pictures of his co-workers from St. Barnabas outside after sending off that 500th patient, trying to encourage everyone with signs that say, keep calm and think positively, and the sun will come out tomorrow, and we will overcome this. Dr. Patti also sent us pictures of the stuff that he and his colleagues have been sent from all over America by just regular Americans trying to lend support, to try to bolster and support and show a desire to help the St. Barnabas doctors and nurses in what they're doing. And it's an amazing collection of stuff from all sorts of people who perceive all sorts of needs. A woman named Marge in Silver Springs, Maryland, sent in respiratory equipment, a respirator and masks. Dr. Patti received what he called an enormous box of Hawaiian-themed gifts and treats from Darlene in Honolulu, who used to live in New York City, wanted to send that. Iris, who works at Planned Parenthood in Ohio, sent the St. Barnabas emergency room some masks. Beth in Chicago sent what she called her own personal supply of masks. So you see the appreciation, both of people sending that stuff to St. Barnabas, but also the appreciation of this St. Barnabas physician saying, do you believe people are being so kind? So it's nice. I mean, that mutuality, I think, is nice to see. But I mean, honestly, big picture in the news, things are terrible, obviously. We are closing in on 1.3 million cases in this country. We are over 77,000 American deaths at this point. The unemployment rate today hit 14.7%, which is the worst level of unemployment in this country since the Great Depression. You do not need to qualify it any other way. The Associated Press tonight reporting that at the highest levels of the White House, there was political intervention to block the CDC from issuing practical guidance about how businesses and services could safely reopen without risking people getting infected there. The White House at the highest levels intervened to block the CDC from releasing that guidance to the American people, which would save lives, because the White House is encouraging all sorts of states to open up. The CDC produced guidelines on how to do that safely. The White House blocked it. And then the White House overtly lied about it. when they were asked. When they were asked about the CDC guidance, they said, oh, that guidance wasn't actually approved by the CDC. Actually, the CDC had approved it, and the White House blocked it. Things are bad. I get it. I mean, if there's one thing that's worse than an astonishingly botched response to an existentially challenging pandemic that is killing tens of thousands of Americans on an ongoing basis, if there's one thing that is worse than that, it's maybe an astonishingly botched response to that kind of an epidemic that just keeps getting worse over time, right? Where the public health people and the scientists are actually exerting less control over the country's response over time rather than more, where the scientists and the public health people who actually know what to do are getting more and more muzzled as the terrible response of our government continues and actually gets worse day by day. So I got it. Everything's terrible. I know. And we are going to cover a bunch of that stuff over the course of this hour tonight, including a look at what might be the worst state in the country in terms of how the epidemic response is being botched and how the people of that state are being prevented from knowing the truth about the scale of the disaster there. Things are bad. I know. We will still continue covering all the badness of it. But for a hot second here, on this Friday night, I do just want to cover one piece of this that is something constructive and innovative and good. So forgive me. Let's go back to Dr. Patti at St. Barnabas for a second. You might remember something that caught my attention in this photo that we showed from Dr. Patti a week ago. And you see he's got his respirator on, he's got his face shield up on the top of his head, he's got his PPE gown, he's got his gloves on, but you can see the sticker of himself, the sticker of his own face, the little picture of a smiling Dr. Patti that is put on his medical gown as a sticker. Dr. Patti had told us that somebody sent that to him. Among all the people who've been sending him and his staff great stuff, somebody sent that picture of him with his headshot so that his coronavirus patients could see his face and know that there was a human being behind all that protective gear. Turns out there is a kind of amazing story behind that. That sticker with Dr. Patti's photo on it was sent to him by somebody who's never met him in real life. Her name is Lori Justice Shockett. She is an artist, but she also has a medical degree. And she is married to an ER doctor, and she is the mom and the stepmom of 2 more ER doctors. She is connected. And right now, one of the things she has started doing is making PPE portraits for medical staff who wear full protective gear when taking care of their patients. So you, the doctor, or you, the nurse, send her the smiling photo of yourself. She will print, laminate, and mail a sheet of PPE portraits that you can stick onto the outside of your PPE gear. So your terrified patients who can't actually see really any of your face, they can at least have some idea of who you are and what you really look like. And where this idea came from, I had no idea, was the Ebola outbreak in Liberia in 2014 and 2015. An American artist named Mary Beth Heffernan, who teaches at Occidental College, she was moved and intrigued by the images of the full spacesuit-like PPE that health workers were wearing while caring for people with Ebola in Liberia. And she started studying it, and she ultimately created the PPE Portrait Project, describing it as an art intervention designed to improve Ebola care. And this was not a whim. It was not a small thing, and it was not an easy thing. This was a deeply researched, grant-funded project focusing on the psychological effects of isolation on patients and ultimately the beneficial effects of puncturing that isolation by allowing them to connect better with their providers. Mary Beth Heffernan, the artist, was invited by the government of Liberia to come work with doctors at Ebola treatment centers in 2014 and 2015. She told us that she has always hoped that what she started doing in Liberia these few years ago would become best medical practice for all kinds of patients who have to experience the isolation of never seeing people outside of PPE, seeing only masked faces for days at a time. Well, now this epidemic that we are in appears to be putting her idea into effect, putting her idea at the center of consciousness, at least, in more and more places. It was Heffernan's work, the PPE Portrait Project in Liberia, for the Ebola crisis that inspired Lori, who saw Dr. Patti at St. Barnabas here on this show. And then she sent Dr. Patti his portrait, and that's why we were able to see him wear it. The same work also inspired a Stanford University researcher who works on quality improvement of patient care. As the COVID-19 epidemic drove tens of thousands of patients into American hospitals, and American frontline health providers everywhere were into full PPE whenever they could get their hands on it, the Stanford researcher, Katie Brown Johnson, got in touch with Mary Beth Heffernan. And now they are working together on a project at Stanford that provides PPE portraits to hospitals across the country. They have a DIY version of the project on the web, which is basically a template that health workers can use to do this. I will also tell you that we got kind of a hilarious offshoot of this idea from a brother and sister team named Linda and Jack. Jack was recently being treated for cancer at the hospital during the COVID-19 epidemic. And after seeing all the medical workers dressed head to toe in protective gear, Jack and his sister Linda and their other siblings decided to design their own sort of homegrown, home-conceived version of this very fancy, high-level art world, high-level medical world idea. And what Jack and Linda and their siblings came up with is a version of it that is sort of equal parts awesome and hilarious and slightly unsettling. Look, behold, it is the Selfie Mask. This isn't you printing a portrait of your straight-to-camera smiling face on a sticker that you put on your gown. This is you approximating the look of your face as kind of a mask overlay. It's like wearing a face suit of yourself on your face. They tell us they've now made a bunch of them at the hospital Jack is being treated at for cancer. This is Jack's oncologist wearing his. Look at that. He could shave that goatee. Nobody would ever know. Jack and Linda's brother Andy helped come up with a fairly simple way to augment a normal 2D image of a person's face so that it could wrap around a traditional mask, a traditional face covering, along with a link to the Stanford template for health workers to get those portraits for their PPE gowns. We'll post a link on maddowblog.com to the Selfie Mask web tool that lets you upload an image and print one for yourself. Just in case you, too, want to stop walking the dog looking like this and instead want to start walking the dog wearing your own face on your face, right? I told you, it's like equal parts hilarious and awesome and unsettling. But it comes from this idea that is deeply rooted in patients needing that human connection with their providers. And it turns out to have pretty good data, pretty good data basis in terms of understanding how this can help patients when they are otherwise at what may be the worst and most scared time in their lives. Joining us now is Katie Brown Johnson, who is the research scientist at Stanford University School of Medicine, who I just talked about, who helped revive the PPE portrait project invented during the Ebola crisis, now being put back into practice for the coronavirus era. Ms. Brown Johnson, thank you so much for being with us tonight. I have to ask you how much of that I got wrong, or if I explained the basics of it in a way that seems coherent.
Oh, no, you're so coherent, Rachel. Thank you so much for having me on the show.
Tell me about the way this idea, which is sort of cute and intriguing and interesting and warm-hearted, how it ultimately translates. I mean, you are a serious researcher in terms of patient outcomes and the way that patients interact with their healthcare providers, how that can ultimately affect the course of their care. What does your research show? What do we know about how this improves things for patients?
Yeah, so I'm a social scientist and very interested in human connection and patient-provider connection. And so with the fear and isolation that was coming up around COVID, we knew we needed to address it right away. So the research behind this, a warm and a competent provider connects with the healing mechanisms within a person's own body. And PPE, obviously, it's straight up and down competence. It tells you competence right away. The only warmth that you might get would be a PPE portrait. And so that's really some of the basis of the research that has us interested in pursuing this.
I can imagine, I mean, just seeing Dr. Patti wearing his portrait. I mean, we had talked to him in his apartment, so we knew what he looked like. And then we had received these video diaries from him in the ER at St. Barnabas, where he is completely covered up. And sometimes we have to, use subtitles in order to be able to convey what it is that he's saying. There is that barrier in terms, but being able to see him, you are able to make that human connection back to the guy who you recognized or the guy who you might think you could know, rather than having this almost alien interaction, even while somebody's doing their best to save your life. I mean, I think even those of us who aren't patients sort of inherently get how this might work.
Absolutely. I think it's really valuable for patients. I think the exciting thing that we shouldn't have been surprised, but we've been surprised at how important this has been for healthcare workers. So healthcare workers experience a huge amount of burnout in general, and we're really hoping that this, we hear from them already, that this really helps them feel humanized and reconnected, and those are the types of things that are going to help our healthcare workers. Those are the types of feelings that are going to help our healthcare workers be able to do the long haul that COVID is really calling for.
Katie Brown-Johnson, research scientist at Stanford University School of Medicine. Katie, thank you very much for helping us understand this tonight. It obviously captured our imagination a little bit, but understanding that this comes from a pretty deep place in terms of your understanding about patient outcomes, it's really intriguing. Thanks for helping us understand.
Thank you so much for having me, Rachel.